the executive witness, the director, Mamadou Samba. And I will swear you in, sir. Thank you. Raise your right hand. Do you swear and affirm that your testimony and any statements that you make before us today to be truthful and complete?
I do.
All right. Thank you. And you can begin.
Good afternoon.
Good afternoon.
Chairperson Anita Barnes, members and staff of the committee. Before I go any further, I'd like to join the mayor in sending my prayers to the family of the firefighter who we lost this morning. I am Mamadou Samba, Director of the Mayor's Office on African Affairs. I am pleased to testify before you today on Mayor Bowser's fiscal year 2015 budget entitled Pathway to the Middle Class. As Mayor Bowser recently testified before the council, each agency plays a critical part in ensuring that district residents in all 8 wards have the education, economic opportunity, public safety, neighborhoods, environment, and infrastructure they need to reach the middle class. Mayor Bowser's fiscal year 2015 budget submission will ensure that our agency and the entire government have the necessary staff, resources, and the help to meet these ambitious goals. As you know, this budget is a product of an unprecedented amount of outreach, resulting in a better budget, and of the Office of African Affairs will continue that kind of outreach. Transparency and accountability, including this hearing led by the council to fine-tune and implement fiscal year 2016 budget. Now let me briefly describe my plans for the agency in the upcoming fiscal year. First, our goal is to increase engagement with the African community, develop and implement targeted programs, focus on outreach, capacity building, multicultural awareness, youth leadership development. During FY16, we look forward to implementing programs currently being planned and discussed, including a health and wellness summit specific to barriers to treatment and access to care, an African diaspora leadership program to provide young Africans living in the district an opportunity to also join the middle class, and finally our upcoming annual African festival planned for September that many in the district and surrounding jurisdiction look forward to attending every year. Our second goal is to strengthen our collaboration with DC government agencies and their existing programs. For example, we are currently collaborating with MPD, Metropolitan Police Department, Homeland Security and Emergency Management, and Fire and EMS Services to launch an interagency African Community Public Safety Task Force. The task force will work closely with public safety agencies to promote and facilitate better partnership with the diverse African communities. Emphasis will be placed on increased outreach and training for both the community and public safety officers, with special consideration to language access, cultural barriers, lack of trust, fear of retribution, stigma, and stereotypes. Most importantly, the task force will promote safer communities by addressing, among other things, domestic violence and identifying community-specific response needs. Our third goal for the fiscal year 2016 is to increase support for 30% of African small business and entrepreneurs to better understand the complex business regulations and take full advantage of available resources. So far, we've partnered with the Department of Small and Local Business Development, the Alcoholic Beverage Regulatory Administration, ABRA, to engage African business owners in the district. Our goal is to ensure that the African businesses can continue to contribute to the economic development of the city and have a competitive advantage in their respective business industries. I will now like to discuss a few issues raised at the agency's performance oversight hearings, for which follow-up was requested. During the last oversight hearing, you took great interest in learning more about the African Community Grant programs and our grantees. As you know, the FY14 Budget Support Act extended the Office of African Affairs grant-making authority of $100,000. The grant is intended to fund community-based organizations that provide services to the African community. Grant funding is largely determined by the strength of each program and their alignment with the mayor's priorities. In FY15, the Office of African Affairs funded 8 organizations. They are the African Women Cancer Awareness Association, Citywide Computer Training Center, the Ethiopian Community Center, Hepatitis B Initiative of Washington, D.C., Conquerant of West Africa Dance Company, Many Languages, One Voice, the Oromo Community Organization, and the Person Center. These organizations provide a wide range of valuable services to the diverse African communities, notably computer training and workforce development, free cancer and hepatitis awareness and screenings, language access services, technical assistance, and capacity building for the underserved communities. In FY14 alone, our African community grantees have collectively provided service to a total of 3,909 Africans through our grant programs. And we expect an even greater number for the upcoming years. But I'm most excited about our grantees' recent efforts to partner with one another in areas where resources, ideas, and efforts can be maximized. These efforts come after a series of group and one-on-one meetings that I've held with each one of them, where I strongly suggested the need to join our efforts for efficient use of our tax dollars and for more collaborative approaches to creating a more unified and stronger African diaspora community in Washington, D.C. Finally, these resources allocated to the agency in the mayor's proposed FY16 budget will be critical in achieving my office's mission in helping to grow and preserve the middle class. The council and this committee, led by you, Chairwoman Barnes, have been key allies in this effort, and I appreciate your continued effort to ensure we operate efficiently and effectively. Thank you for the opportunity to testify, and I look forward to any questions you may have.
Thank you very much, Mr. Sabo. I like hearing that you have initiated the partnering of the grantees so that they can better serve the total community. I'm wondering, is this a signal that these are the same institutions that will be able to apply for grants again in FY16?
It's a signal, but it's not that kind of a signal.
All right.
It's a signal in the sense that I'm big on collaboration. It's my philosophy. I mean, I think everything we do, we should be able to partner with other agencies, other organizations. So it's a signal that we share the same challenges. We share the same issues. So we should be able to work together to address those issues, not just in the African community, but also with non-Africans like the Latino community or the Asian community. So the signal that I sent to them was, going forward, we will also look for strong evidence of collaboration in grant applications and proposals.
Very diplomatic. Thank you very much, sir. But the key is that the services
Yes.
That are provided to the community, you do not foresee any diminishing of the services that are provided to the African community.
Not at all.
Okay, I'm glad to hear that. I just have a few questions.
Sure.
Let me flip to that part of the I'm glad you shared with us the approximate number of individuals that have been served through the collaboration of all of these entities that you currently fund, your grantees. But does your office provide direct services to members of the African community here in D.C.?
Yes, we do. Besides the grant, on a day-to-day basis, we have constituents come to our office needing help with finding jobs, for example. We have a couple of our staff members and interns sit with them, help them with their resumes, because a lot of the constituents that we have either just came from Africa or they haven't been here long enough. So even they don't understand the resume formatting, which is different from Africa to here. So we work with them, help them find jobs, help them, write cover letters, and also help them have access to other services that are provided to the district. So most of the services that we provide is really linking them to the existing resources and information available in the district.
So it's primarily linking and referrals. Okay.
Yes. But
you do the resume.
Yeah, but we do the linking and the referral with special emphasis on the fact that we understand there are language barriers, there are cultural barriers. For example, there's a lot of outreach being done where information is just translated in Amharic and French and they put it on a flyer. But the information is not getting to our community because our community is a word-to-mouth type community. Not only you have to go to them to make sure the information gets to them, but you have to go to them to where they are comfortable. And we are comfortable in our churches, in our mosques, and in our neighborhood associations. So that's the extra value that we provide.
All right. So then I must ask, how many individuals do you believe your office will reach out to in FY16?
Well, in FY14, in FY15, we reach a total of 11,000 Africans, and 3,909 of that is done by the grantees, and the rest is through our service. So I think in FY16, I plan to reach at least 15% more of that.
Okay, very good. And where are you located?
At the Reef Center on U Street.
The Reef Center.
Yes.
Okay. And are you a cabinet level organization?
Yes.
You're a cabinet. And you report directly to Ms. Hines?
Yes.
I know that your office recently hired an outreach liaison. Mm-hmm. Is this individual fluent in some of the languages of the continent, or what should I expect?
The continent has over 3,000 languages. I don't think she's fluent in all of them. But yes, she's actually sitting on my right. We will look for someone who is fluent in French.
Right.
She happens to be fluent in French and Amharic, so it's actually an added benefit. So yes, she's very.
And so are those the two dominant languages on the continent?
Two, yes.
Okay.
And she speaks both.
She speaks both.
Yes.
Congratulations. Very good. And is this individual going to serve as your language access coordinator, or is there some other role that they assume?
Well, so I'm very proud of the fact that my office, everybody there wears multiple hats. So in addition to her doing the outreach for the office, she will, yes, of course, familiarize herself with the language access, just like I will and everybody else in the office, and we will sort of, help each other to make sure that all bases are covered.
Do you have any volunteers working in your office by any chance?
Yes, we rely heavily on interns. Actually, we have currently 2 interns just finished. We have, how many? We have 5 interns currently in our office.
All right, and tell me more about your interns. How do you get them? Do you recruit them from the general public? Are they from universities? Just what?
Yes.
And what are some of their tasks that you give them?
So our interns come from all over the place. Like yesterday, we had a new intern just came from Syracuse University, and he will take part in President Obama's Young African Leaders Initiative, which is, international program. Some come from George Washington, all over the, college students in the district and even elsewhere. Usually they come for the summer. We have some that are not college students, and when they come in, their task goes anything from our newsletter, which takes a week to actually prepare and publish, researching information that's relevant to the community, providing constituent services, designing programs. For example, I have each of my interns, I've assigned them a council committee, and they follow the committee, and they report to us every week on what is the committee doing. And I also have them assign other agencies where they, for example, look up the Office of Aging to see what program exists there that our office can benefit from or partner with them on. So they do pretty much everything.
And you say you have 2 interns?
We have 5 right now.
5 now.
Yes.
Can you give me a summary of your written policies as it relates to your procedures for administering and monitoring your grants?
Can I give you a written policy?
Yes. I mean, can you sort of quickly describe basic steps
Sure.
in the policies that you have in order to?
I'll forward to you the official copy, but pretty much what we do is, so for one, we define the criteria in which is the priority, in what areas do we want to fund. And once we define those priorities, we go through a regular cycle of, having the request for proposal. When we put out the request for proposal, including description of what are the requirements, do the organization need to have a 501c3, do they need to be in a district? And then once we get the request for proposal, we hire actually reviewers, a panel, who actually review the proposals. And these are outside people, and they review them. This is just a synopsis, pretty much. They review the grants, and they forward the finalists to the office and for final decision. There are other things involved in that. When we launch it, we do a Q&A. People come in, we sort of give them a brief description of what to expect. But overall, we launch the request for proposal, review it, and make the final decision based on the priorities.
Okay. You mentioned you have grant reviewers. Can you give me an idea of how those individuals are recruited, and are they paid? And
no, these are not
how
paid.
How you use their services?
No, these are not paid. We put out a call for reviews, just like this is how it's normally done. A call is put out for reviews with qualifications, of course, and then we go through it. We have our deputy director Heron. She manages the grant, and she's responsible for all of that, recruiting the reviewers who have defined qualifications. And then once we select which one we want, we then send them the proposal to review, also based on criteria that we've given them for them to grade, and they forward to us, their results, and then we take it to the next step.
All right. We will be asking, this committee will be asking for a copy of,
yes,
of that process, and particularly how you select your reviewers.
Yes.
I think that's important for everyone to understand.
Sure.
I mean, thank you.
Sure.
And I know my time is I want to give my colleague an opportunity to ask questions, so I'll come back. I just had 2 more.
Sure.
I'll now turn to Councilwoman Nadeau. She may have a few questions.
Thank you, Madam Chair. Hello, Director. How are you?
Good. How are you?
Good, thank you. Continuing in the discussion around the grants, how do you gauge the outcomes and which of your grantees are being successful in helping you reach your goals?
That's a very good question. Actually, I visited one of our grantees a few weeks ago, and he provides computer training and job training. And I asked him, how do we know if your program is successful? And again, some of the grantees, for example, if someone provides cancer awareness and is able to save a life, I think that's enough to gauge if the program is successful or not. The other thing, we just want to make sure, we have to follow up to make sure that more people go to those doors and get access to more of those computer training and be able to transition into real jobs. For other services, we have to make sure that they reach more people, for example. Instead of reaching 800 people, we want them to reach 950 for the same amount or less. And hopefully that would be a pretty good indicator of how successful our program is. But also, the partnership is, I think, a better way to gauge this real success, cross-culture and cross-country.
I certainly commend the way you're building collaboration and partnerships. What was the answer to your question when you asked your grantee about how he knows if he's being successful with the computer training?
Well, he was able to give me a pretty good answer. I was satisfied with the answer he gave me. I was satisfied with the fact that more people are going to his doors now and using his service, which is one way. And the other way is some of them are, again, like I said, transitioning, learning more skills that they didn't have or didn't know existed. So he's pretty open to it. But he was also open to the suggestion that I made to him that we need to do a better job at knowing for sure how successful things are going forward.
So what measures could you put in place in your grant program to measure the outcomes? And when I say that, I mean not just how many people walk through the doors, but
Sure.
how many people are receiving skills that they then put to use in a job or in another program.
That's true. Actually, we are launching a few programs in my office where what we want to do is once residents go to a computer training, for example, when they finish the training, maybe they can come intern in my office, or they can come intern with you, or they can come intern in another agency, and that will eventually lead to a real job. But the fact is, we have to provide a bridge. It's not just them going to get in. It's not just them going through those, getting the computer training and getting a real job, but someone has to provide them either an opportunity to get an internship or temporary job, which will eventually lead to a better job and a better way to measure the success of our program.
I agree. And I do think one of the things that we need to be thinking about too is what jobs are available in the pipeline so that we're helping people get the right skills so that they can qualify. So I will keep pressing on that as we continue to work together.
Okay.
I also wanted to ask you, what do you think are the most pressing needs of the population you serve? What do they come to you for most?
Jobs and housing.
Mm-hmm.
Language issues, language access is another issue. Sometimes you have a lot of those immigrants who just arrive in the U.S. between 0 to 5 years, and the research shows that those are more vulnerable to different things. For example, those who've been here between 0 to 5 years, like myself when I first came to the U.S., those are least likely to speak English fluently. They are least likely to understand the complicated healthcare system. We have HMOs, PPOs, POSs, fees for service. It's complicated. They are less likely to be stable economically, financially, be able to buy health insurance. So those are some of the challenges, but luckily we have our grantees like the African Women Cancer Awareness who provide services to them who don't have health insurance.
So, what have you learned anything about how our Language Access Act is working across different agencies from the experiences of the people you serve, and where we need to do better across the different agencies?
Honestly, not much. We work closely with the Language Access Director, Winter, at the Office of Human Rights. So we've been in several conversations. It could be improved. But we'll definitely come back with some suggestions as we go through and see from the African community what are the assessments and what can be done to improve it.
And when you mentioned that housing is one of the things that people have the most need for, what are some of the programs that that your constituents are accessing?
Say that again?
What are some of the housing programs that you're directing them to?
Well, so earlier last month, I met with the director of Pali Dinosaur, and the meeting was just that. How do we make sure that the information gets there? And it goes back to what I said earlier. The information is out there. The information is out there. It's in French and Amharic, but it's just sitting somewhere. No one is getting it. So what we're doing is we are taking that information and we are going to the community. For example, you have to understand a very important dynamic is that the African community, you have all of this, like, organization. Like when I go home at night, for example, one of my favorite things to do is to listen to the radio, community radio programs. And this is what the information gets to them. So we are making sure right now, actually we had a discussion yesterday, to really take our time to search and collect the useful information about housing, and then design a very strategic and effective way to get it to the community. And we are currently working on it, and we'll definitely update you as we go through.
Thank you very much. I appreciate that. Appreciate your testimony. Thank you, Madam Chair.
Thank you very much. You mentioned you have job fair programs. Can you talk a little bit about how you measure success with your jobs fair programs? I know it's numbers, people turn out, but are there a substantial number of referrals to jobs, or just when you have a jobs fair, what happens? Or is it just dissemination of information?
Well, yeah, so mainly, I don't know, well, maybe I misspoke by saying job. I don't know if I said job fair program, but essentially what we have is we have constituents that are coming to our office needing help with jobs. And we sit with them to really do an assessment of where would they fit, what would they want their resumes. For example, at the Reef Center, on the second floor, there's a resource center, a job resource center. And for the past 3 months, I've had an intern who's been working to develop, so we can use some of our space to turn into a job resource center. When people come in there, we can sit with them, work with them with their resumes, help them with the translation. And when we went to the director of the resource center, he's very appreciative of the work that we're doing, because we are taking a heavy load off of them. Because sometimes when you go to the second floor, there's a long line up to the elevators, and some of those that are African can come upstairs. We can do the work that they would have to wait an hour or two for them to do, and then we can just send them there for the remaining. And so we are currently discussing on how they can let us use some of their softwares in our office, so we can sort of be a quasi-resource center for them.
Very good. Thank you.
Thank you.
I think that's a good way of using some of our resources. Again, collaboration, as you have pointed out. Other than the issues that you've already mentioned, as service delivery needs, housing, jobs, are there any challenges that your office faces in servicing your population? Lack of computers, lack of space, personnel?
We do have the support. We have computers. We have, the additional staffing was very valuable in taking a big load. So it's been a big relief of that. One thing, which is something like on the policy side, as testified earlier by someone from the Hepatitis B organization, the lack of data is something that poses a challenge. And that's not something for the office, that's just something even at the national level. Sometimes we would like to see, for example, know how many African immigrants, what type of cancer is more prevalent in the African immigrant community, but the data doesn't show us that. There's not enough research done on the African community to tell us allow us to analyze trends over time, to predict trends or to really sort of match the policy with the numbers. That could be complicated sometimes because I would like to think some agency directors will need to know, for example, of the 40% of African Americans who like housing, what language do they speak? So when we design outreach program, we can design using that language, or what country are they from, something like that. But I think we can, with collaboration again, we can overcome that pretty shortly.
Okay, well, I thank you very much, and
Thank you.
I don't have any other questions. And Councilwoman, you have any other questions? We thank you very much.
Thank you very much.
Community. Thank you.